everybody, and welcome to the Truth Be Told podcast. My name is Erica, and this is Brandy.
Hey, y'all.
And as always, if this is your first time joining us, we just want to let you know a couple things about our podcast. It's focused on providing the underserved and underprivileged communities, particularly communities of color, with information and tools to improve their dental health experience overall. Okay?
Yes, ma'am.
All right. So we're quick, we're fast, we give you what you need. Okay?
Yes, I like that.
All
I
right.
like
So
that.
this episode this week is all about your diet and your health. Excuse me. Sorry. Your diet and oral health. I missed that part, right? And this
There
is
we go.
about
That's
teeth.
the look. That's the ticket right
Right.
there.
So yes, diet and overall health. So, we be just chomping, eating, and we say, okay, we just want to brush our teeth. We're going to floss. That's what they tell us to do, and we're all good. But there be things that you're eating that could affect you even if you are flossing and brushing your teeth regularly, correct?
Yes. Yep. You got
Okay.
it, Erica.
So
So
break
yeah.
it down. Break it down, Bran.
Break it down. Okay, so I'm going to go through a few things, and so once again, I'm just looking down because I took notes, and I want to make sure I give you guys all the information. I don't skip anything that I was thinking of. But yeah, so how does your diet affect your oral health? So a lot of things that we eat can be sticky or chewy or acidic. And if they're not candy, we assume that it's okay to eat certain things. So certain things, even if they're not candy or chewy or sticky, like gummy bears or Sour Patch Kids or anything like that, you can still have certain foods that affect how your overall oral health is and how to maintain it. So there's a few things I want to go over because I know there are a lot of coffee drinkers out there. Erica, do you drink coffee?
I do not drink coffee. I don't drink coffee. I don't drink soda.
Me neither. I never got into the coffee thing. Like, mad people be coming in like, "Oh, I need my coffee. I need my coffee
They
to wake
do.
up."
They're like so obsessed when I have like guests to spend the weekend and stuff. They'll be like, "Oh, do you have a coffee pot?" And like, I have coffee in the refrigerator. My aunt says put it in the refrigerator. I don't know what that's about because I don't drink coffee. They're like, "Do you have the filters? Do you have the?" I'm like, I don't know. I don't do this.
You're like, yeah, I don't do, and neither do I. And I never got into coffee, so I'm just like you. I don't drink coffee. I don't drink soda, but a lot of people do. So for those folks, a lot of times you'll hear because people will have like stains associated with the coffee, right?
Mm-hmm.
So a lot of times you'll hear people say, "Oh, well, as soon as I'm done drinking the coffee, I'll brush or whatever to try to keep the stains down." What are some other things that you heard of, Erica?
So I know about the coffee, and I know wine, like red wine that can stain your teeth, right?
Red wine.
When I was younger, I had a family member. She loved her red wine, but she would drink it with a straw.
There you go. That's what I was looking for. Have you ever heard anything like that? So
yes,
you hit the nail on the head. Yes. So a drinking straw. So some people use a drinking straw with red wine or with coffee because it doesn't hit your entire mouth. It'll just be like a little stream so that the color doesn't stain your teeth as much. You might still have some stain, but straw is good. But a lot of people will say they'll brush. And I just want to let folks know who are coffee drinkers or who drink soda or wine, like Erica said, if you're brushing right after to try to minimize stain, that is not a good thing. So the coffee and the wine and the soda, they all are very acidic. And so when you drink them, you have an acid attack on the teeth. And that lasts for a period of time. But if you brush right away, you're going to kind of, I don't want to say destroy, but you can damage the enamel because the acid is still sitting there on the teeth. So even if you rinse right away, like rinse with water, the acid will be there for a period of time. And if you brush over time, you can damage the enamel, which can make you more susceptible to having cavities once the enamel is breaking down.
Who would have thought? I worked with this woman who as soon as she would eat, she would brush her teeth. But I think she had a lot of dental issues. And so when she got her teeth together, she was real serious and extra about it. So in this case,
it's the wrong thing to do. So even right after eating, whatever you're eating, you really should wait at least 20 minutes or half an hour before brushing. because you don't want to have that acid sitting there and then you're brushing the bristles over top of the acid, which is
That's what's
already
moving around everywhere.
exactly.
Look at
So
that.
you don't want to do that. And a
Look
lot of
at
people
that.
don't know that. So I wanted to definitely point that out. So some other things. So after I said after coffee, Erica, you said after wine, candy, soda, any kind of citrus fruits or berries, anything like that, you don't want to brush right after. You want to wait at least 20 minutes to a half hour. Okay.
Okay. That's good to
Because
know.
it's good to know.
In
It's
my
good to
such and such years on the planet, I
know. Be like,
didn't
well,
know
I don't need
that.
to know.
I didn't know that. It's always brush in the morning. Brush, sometimes brush at lunch, but that's when you're at school and work and stuff. That's hard. But like I said, that lady would, but brush in the morning, brush at night.
That's it, for at least 3 to 5 minutes. If you want to brush, it's the length of a song.
Length of the
You want to
song.
brush
Yeah.
longer, not harder. So if you brush in 2 to 3 minutes, 5 minutes is a long time until you get used to it. But yes, Erica, brush in the morning, brush at night. You can brush at lunch if you have time, but you're going to have to wait, right after you eat.
It's
It's
kind
not a
of
good time.
like you're in the workplace and you're in the bathroom and it's like 5, 6 stalls and here you are in the sink, brush it, brush it, brush it, brush it, brush
Listen,
it, brush
no shame, because you be the only. I bet you be the onlyest one in there doing it.
Did
That's
you
what you
catch
get.
that reference? Did you catch that? Do
What?
you
No, I didn't
remember
even hear what you said, child. I'm
when
sitting.
I said brush it, brush it, brush it? Do you remember from the first Grease? Do you?
Oh, child, look, Greece is the furthest thing, but
I
yes,
know, but
and I
you didn't catch on. You said because usually
no,
you're in
because
sync that way, so I figured
I
maybe
would
you
have
would catch.
been
Yeah.
with it, but with Greece, no, not so much.
No. Okay. Anyway, we digressed.
So, all right, yeah. So with anything you eat, there is an acid attack on the teeth, no matter what you eat. But depending on the foods, it's whether that acid attack lasts a long time or a short time. And if it's how long in duration it lasts and how hard it is on the teeth. So, Erica, I have a question for you. With
Hmm.
that in mind, what I just said, what do you think if you had a bag of M&Ms and you was like, I'm gonna treat myself to these M&Ms, I'm gonna eat these M&Ms. Do you think it's best to eat the whole bag of M&Ms at once, or do you think you should maybe eat half now and half later? What do you think?
Probably eat it all at once so you can get all that in at one time instead of because then
Absolutely.
you're breaking it. You're eating the bad stuff, leaving it on your teeth, or and then eating more of it later. So now it's
Yup.
covering more spaces in your mouth.
You
Is that
got
right?
it. So, yup, because
Yay!
you got it right. So, if you're going to have an acid attack on your teeth, you might as well do it all and get it done and out the way, because the more you're doing it, the more frequent, the more acid attack and acid wear you have on the teeth. So, that's a great answer. And not everybody gets that. Because if you think about it, you're like, well, if I have a little now, then that's not bad. And if I have a little later, but it's the multiple.
Well, you know why people saying that because they thinking about their waistline. They're not even
Yeah.
thinking about the
And
teeth
I'm
part.
talking outside.
Yeah, I'm just saying that's what they're
Exactly.
doing.
Like, you're probably right. That is probably what
Yeah.
people are thinking about.
Mm-hmm.
So yeah, I don't know. But yes, so we'll do that. All right. That. Okay, so good answer, Erica. You got it correct. A plus
Yay!
plus.
Gold star for
Or
me.
yes, gold star. Let me see what else I have here. So when you eat a poor diet, so a diet that is heavy in sugars and starches, that encourages tooth decay, right? So the reason why is because those starches, the bacteria from it feed the plaque inside your mouth,
Mm-hmm.
and that leads to cavity. So the more plaque you have that covers the teeth, the more it will destroy the enamel, the more cavities you'll have over time.
And that's why you're supposed to um go to the dentist every 6 months and get your good cleaning to get the plaque off, right? If you can't do it with brushing, or is
Okay,
that
yes, but really what you doing is going to be on a day-to-day basis. So if you think about it, out of 365 days in a year, you're going to the dentist how many times? 2 times? So what does that mean over the 365 days? So really, it's just like maintaining a car. The maintenance is going to be on you. So you come for us to kind of like check up. Just like if you're taking your car in for an oil change, just to make sure everything is good.
Mm-hmm.
But whatever you do on a day to day is what you're going to get.
Okay.
That's it. So if you think about it that way, like yes, you should come every 6 months. That's 2 days out of your 365-day year. So if
Okay.
you come, if
Okay.
that's all you're doing is saying, "Oh, I'm making my 6 month checkups," because I have patients like that. Nah, that's not it. Because if that's all you're really focused on when you come in, it's going to be a lot for me to do. It's going to be a lot for you to sit
Hmm.
through. So
Yeah.
you want to make sure you're
Yeah.
flossing every night before bed. It's the only way to
Hmm.
clean in between your teeth. The toothbrush cannot reach down there. So if you're not doing that, you're liable to have cavities in between the teeth,
Oh
which you don't
God.
want to have. But
No, no,
um,
no. It's just gets it's just like no,
yeah, it
no.
gets to be a lot. It gets to be a lot.
Yeah.
Okay, so I'm sorry. Go ahead.
Um, I literally had a question for you and I
Yeah.
forgot it. So we'll just move
Uh,
on.
okay. Well, you marinate on that.
I will
Okay.
think about that because like I was
Okay.
listening to you and then I had a
Yeah,
question
listen,
and I was like, and then it left. It's
just
gone.
stop me when it comes
It
back.
had something to do with food, of course, or something like that of that nature, obviously, but I can't remember what it is now.
Well, maybe I'll go over it. Maybe I'll go over
Okay,
it
maybe
now.
you will. Okay.
All right, let's see. So there are certain foods, they're called detersive foods. Detersive just means cleansing. And so these are foods that you should eat after you've had something sticky or chewy or gummy or starchy, like white bread or pasta.
Rice.
And those foods, rice, exactly, like kind of sticky foods or kind of any kind of candies or jelly
Uh-huh.
foods. And these foods, they act as a toothbrush. So when you're chewing on them, they're crunchy. They actually stimulate the saliva production, which kind of flushes the food particles away.
Really?
Yes. And so can you guess
Okay.
one kind of a food that I'm talking about? Like one that you think if you eat it or chew on it, it might help clean your teeth?
Well, I just said rice, and I love rice.
Okay, so no, rice
So
doesn't
no.
help clean it.
Oh,
So
I thought you
a
said
food that
okay,
helps
okay.
clean
I'm
it.
so sorry. Okay. So a food that helps clean the teeth.
Something
Okay. Can I can
crunchy.
I get a hint? It's like can I get the color of it?
Okay, it could be a fruit or a vegetable.
I
There's
was gonna
several.
say fruit. I was gonna say fruit, but
A
I was like,
specific kind of fruit.
um, all right. So it can't be oranges because that's acidic. How about a
Well,
banana?
something crunchy.
A crunchy fruit. Crunchy fruit. Um, I don't know. Those
Okay,
strawberries aren't crunchy.
I'll give you a hint, or
Okay.
I'll give you the list. So apples,
Oh yeah.
carrots, celery, pears. Those
Oh,
are kinds of fruits that if you chew on those fruits after you eat, it will help to clean your teeth. It'll be less for you to do later. It removes a ton of the plaque.
really?
Anything crunchy, anything just like those things, broccoli, like raw
I
broccoli,
love broccoli.
anything like it will help. As a matter of fact, when I was in dental school, we had to do these disclosing, they were called using disclosing agents. So after we clean somebody's teeth, they would put this disclosing agent on the instructor, and then it would be really pink everywhere, but it was still plaque. And we would be serious, like, oh, we cleaned, and they're like, well, what's all this? And then we had somebody who ate an apple on one side and didn't on the other side, and all of the plaque was gone.
Oh, so that's
So
kind
we
of
could
like
see.
on SVU when they have that black light and it
Yeah,
shows all
kind of
the
like that. Absolutely.
it
It's
shows
kind of
all
like
the,
that.
you
With
know.
the luminol. Yeah, it's
Yeah.
kind of like luminol, but for inside your mouth.
You
Absolutely. It's
know,
called
I
disclosing
totally
solution.
miss what you were saying about I'm thinking about food, right? Because I eat dinner. You were talking about the rice and the pasta, and I was like, is she saying that that's going to help? No, no, no. That's not what you were saying. That's why
No,
I was
baby.
like, well, I was like, I can eat more rice? Is that what you're telling
No. Not unless you want to. And then just getting there with the floss and make sure you know what you're doing and stuff.
I like carrots. I like the carrots because of the crunch. You're right. Because
Yeah, so
I'm a carb person, obviously. So
Mhm.
I want something that's going to make me feel like I'm eating carbs, but I'm not. So that crunch does definitely help.
The crunch
And
is what does it. Yep.
yeah, broccoli, love it. Yeah, that's
Yep, all
great.
those kind of foods.
I
So,
like
having
that.
said that, I'm going to give you guys a quick list of some of the foods that can harm your teeth and some that can cleanse them. So, any pastries, cookies, crackers, chips, white bread, any kind of sweetened cereals, cake, dry fruit is one because it's sticky. Um, if you like any flavored milk, like strawberry or chocolate milk, sweetened yogurt, beer, or like any kind of sugary beverage. You know what I mean? Like soda, or if you drink a lot of juices, all of those things can harm the teeth over time. And if that's the bulk of your diet, it can harm the teeth.
I got a quick question for you.
Mhm.
So, what about the different kinds of sugar? Like, we know high fructose is terrible, but what if it's like made with cane sugar? I mean, it's sugar, so what's worse? Does it matter?
Yeah, usually just sugar in its natural form, like you would get in fruit, like fructose, um,
I
is
like how you
okay,
said
but
that.
actually in the fruit. But any
But
kind of sugar you have is going to be an acid attack. Or any
okay,
food you eat, like I said, it's going to be an acid attack. It's just what's the duration, how long is it going to be, how much damage is it going to do.
okay, okay.
So that's any kind of sugary food, including well, like you said, high fructose corn syrup, which is not
That's
great.
really bad because
Yeah,
it's,
it's not good in
man-made and
anything.
it
So
keeps you wanting to eat it and eat it and eat it.
it's addictive.
It's totally addictive. Yeah, exactly.
That's the way it's designed.
Yeah,
They
exactly. I was
designed
gonna
it
say
that
that's
way.
the way they
So.
did it. They did it on purpose,
What was that
all
movie
this.
you was talking about where they did that to black folks? Tyrone.
Oh, that was Tyrone. They cloned Tyrone.
Y'all
I
should check that out.
with the chicken and
Interesting, very interesting. But okay, so those are some of the foods that harm, and some of the foods that help to cleanse. We already kind of talked about any kind of raw, high fiber vegetable, celery, broccoli, lettuce, spinach, cucumber, kale, or even nuts like almonds or walnuts or pecans, because they're really crunchy.
What about those candy toffee cashews that we get from the health food store?
So no, because they got this coffee and the sugar child goodness.
They're so good though.
Okay,
I'm so glad you put me onto those.
Yeah, delish. But yeah, no, though unfortunately they not. I mean, they're the cashew, but they got all that yummy, delicious
that
goodness.
good. Yes, they do.
So, um, if you have meat or eggs, those are all good too. So just a couple lists, you guys, just to give you some information. But that was what I had for today. I'll revisit this topic at some point, but if you guys have any questions about any other kind of foods or to stay away from or to incorporate into your diet, just hit us up. You can always comment in YouTube or Instagram, or, you can visit the website, TuesdayToldPodcast.com. There's an inquiry little page there on the third page.
That was great. I think you gave so much great information.
Yeah, because I think that's stuff like a lot of people would not know. I was trying to think of things that
it was good. It was really informative. Yeah. I mean, every episode I learned so much, but that was really good. Like you just don't be thinking about it. I mean, obviously some of the things I know, but yeah.
It's always good to have a refresher.
It absolutely is because sometimes you forget things when you get older, and you have so much. You have information overload. And you have so much stuff that you're remembering.
Yeah.
So, but yeah, that was awesome. So yeah, she said, you guys, go to our Instagram, go to our Facebook, like, share.
And yes, like, share, and please subscribe to the YouTube
and follow.
channel.
Yes, please subscribe.
Follow our socials. And you can get everything from the website, TruthBeToldPodcast.com.
Yep.
So hit us up.
Yes, awesome. So we'll be seeing you guys next week. We're going to cover... we're going to cover racial disparities. Right. Absolutely. So that's going to be a good one because we already talked a little bit about that earlier, right? Before we started today's podcast. Yeah. So that's going to be good. Real good. All right, guys. So thanks again for tuning in, and we'll see you next time.
All right. Take care.
All right. Bye.
Bye.